Hello, and welcome back to the Fraser Health online cardiac rehab education program. My name is Susan, and I am a pharmacist working in the program. Today's focus topic is cardiac medications. Hopefully, you've already viewed the introductory presentation so that you have an overview of the sessions and format that are provided for your learning purposes and self-management needs. The program has 9 sessions in total, including the introductory class. Presentations do not need to be viewed consecutively, but instead you can pick and choose what best fits your schedule and learning needs. Be sure to view each topic for the most comprehensive understanding of your cardiac condition. So the presentation will focus on cardiac medications for people who have had a heart attack or acute coronary syndrome. The goals of these medications include to control symptoms such as angina or chest pain, improve quality of life, slow, stop, or reverse disease process, such as slowing a plaque buildup, and reduce the risk of another heart attack, and ultimately, we want to prevent death. Now, after having a heart attack or having established coronary artery disease or acute coronary syndrome, people will typically be on a combination of 5 different medications, which include aspirin or ASA, one of Clopidegrel, Prasugrel, or Ticagrelor, an ACE inhibitor, or an ARB, or angiotensin receptor blocker, as well as a beta blocker and a statin. And I will discuss each of these medications throughout the presentation. So a lot of people ask, how long am I going to be on these medications? And basically, it is lifelong therapy. So essentially, you will be on long term, and you'll be able to stop the second antiplatelet agent, so that's that second class, the Clopidegrel, Ticagrelor, or Prasugrel, typically after 1 year. There is also some new evidence to suggest that you may be able to stop your beta blocker after 3 to 5 years. However, stopping these medications has to be done on a case-by-case basis and should be done with the discussion with your specialist or primary healthcare provider. So why do patients have to stay on these lifelong? Well, studies have shown that being on the medications long-term lowers the risk of having another heart attack, improves quality of life, and ultimately it makes you live longer after having a heart attack. So the unfortunate part with this, though, is that you can't really see the benefit of taking the medication. So you just need to be patient and know that the goal is to prevent that heart attack and ultimately live longer. So firstly, I'm going to talk about aspirin, or ASA. Now, how does aspirin work? Well, aspirin is an antiplatelet agent, which means it keeps platelets from sticking together. Platelets that stick together form clots, so the aspirin prevents these clots from forming. And aspirin is used in people who have had a heart attack, and it actually lowers the risk of a subsequent heart attack. It reduces the size of a heart attack, and it increases the chance of surviving if a heart attack occurs. Now, who should be taking aspirin? People who have established coronary artery disease, angina, or previous heart attack should be on aspirin. People with multiple risk factors for cardiovascular disease may also be on risk factors, and risk factors are discussed in one of the other presentations. People who have had a bypass surgery or valve replacement may also be taking aspirin. With aspirin, for protecting the heart, a low-dose aspirin, or ASA, is the best, and that is 80 to 325 milligrams a day. And these are the doses where they're shown to have benefits after a heart attack. Higher doses of aspirin, such as 650 or greater than 325, take on more of an anti-inflammatory effect, similar to a class of medications called NSAIDs, or non-steroidal anti-inflammatories, that we try to avoid in people with cardiac disease. And those are, for an example, would be Advil or ibuprofen. And if taken on a regular basis, high doses of aspirin, like NSAIDs, can lead to more harmful effects, such as increased blood pressure, fluid retention, and increased bleeding, and possibly bad effects on the kidneys. So generally, low doses are best for the heart, so that 80 to 325 milligrams per day. Next, I will talk about other antiplatelet agents. These are Clopidegrel or Plavix, Prasugrel, Effient, or Ticagrelor, Brilinta. These medications are antiplatelet agents that work similar to aspirin by preventing platelets from sticking together and preventing the clots from forming. These medications work on part of the pathway that affects platelets sticking together, a different part of the pathway than the aspirin. These medications also help to keep the stents from collapsing in those patients who have had coronary stenting to help open the blockages in their heart arteries. What are these medications used for in heart disease? These are, again, for people who have had a heart attack or acute coronary syndrome. And in people who have had coronary stents put in, one of these medications will likely be taken for up to 1 year after having a stent. And these are typically used in combination with aspirin, especially after having a stent or after having an acute coronary syndrome. But these agents also may be used instead of aspirin to prevent heart attack and stroke. So with antiplatelet agents, so that's the aspirin, the Clopidegrel, or Prasugrel, or Ticagrelor, the main side effect to watch for is bleeding. And there's more of a risk if you're on 2 of these medications at the same time. So you need to monitor for bleeding and bruising. And obviously tell your doctor or healthcare provider if you had severe bleeding that is hard to stop, or if you have dark urine, stools, or see blood in the stools. Next, I will talk about angiotensin-converting enzyme inhibitors, or angiotensin receptor blockers. The ACE inhibitors, their generic name ends in pril. So all of these are listed on this slide. So examples include ramipril, perindopril, enalapril, and captopril, as well as the others listed on the slide. People also may know the medication by the brand name. So for an example, ramipril may also be known as Altase, and perindopril may also be known as Coversil. The angiotensin receptor blockers, or ARBs, are also or can be used in place of an ACE inhibitor, and I'll get into that in another slide or two. And their generic name ends in sartan. So you can see irbesartan, losartan, valsartan, candesartan, and telmisartan. Again, they may be known as their brand names. For example, irbesartan may be known as Avapro, and losartan may be known as Cozar. Now, how do these agents work? Well, essentially, they allow the blood to flow more easily and make the heart work easier and more efficiently. These agents are used after a patient had a heart attack in order to prevent future events from happening. Also, it's used to treat people with high blood pressure as well as heart failure. The most common side effect of an ACE inhibitor is a cough, and this is a very dry, persistent, annoying cough which may develop after starting the ACE inhibitor. And some people have it become so bothersome that they switch over to the ARB, or angiotensin receptor blocker. Because both the ACE and the ARB affect blood pressure, they may cause dizziness, especially when you get up too quickly. So you need to get up slowly and take your time when you're changing positions. So these medications can have effect on the kidney and also help the body retain potassium. So when starting or changing the dose of the medication, we will typically check the kidney function and potassium. And in addition, we'll also monitor the blood pressure. So for more serious but rare side effects of ACE inhibitors or ARBs, and these are ones in which you should seek medical attention. These include a decreased urine output or production, or something called angioedema, which presents as swelling of the lips, face, and eyes. Next, I will talk about beta blockers. The generic names of beta blockers end in olol. For example, bisoprolol, metoprolol, carvedilol, atenolol. They also may be known by their brand name. For example, bisoprolol may be known as Monocor, and metoprolol may be known as Lopressor. Many of these medications have been around for years, and so they may be more well known by their generic name. How beta blockers work is that they reduce how hard the heart has to work, and they do this by reducing the heart rate and lowering the blood pressure. Beta blockers are used in people who have already had a heart attack in order to prevent future heart attacks, and they do this by preventing chest pain or angina, lowering the blood pressure, as well as regulating the heart rate, because we know it lowers the heart rate. Side effects of beta blockers include having a lower heart rate, and in patients with heart failure, symptoms of fatigue and lack of energy may actually get worse before they get better. So when someone is started on this medication, it might be that you're a little bit tired and lacking energy, but it should improve over time. These agents also may cause dizziness and lightheadedness because they decrease the blood pressure. And what we monitor here is the blood pressure and the heart rate. And as someone who's on these medications, you might notice being dizzy, and that could be because of the blood pressure. Important points with beta blockers include that you should not stop these medications abruptly, as this could lead to a rebound increase in blood pressure and heart rate, and rarely stopping abruptly has led to a heart attack. So you need to always discuss stopping a medication, in particular the beta blockers, with the healthcare provider. And they can consider decreasing dose or may have a case in which you need to stop abruptly, but a discussion with the healthcare provider is always best. Also, if you notice ankle swelling or shortness of breath, you should see your healthcare provider and discuss this. The last medication in the cocktail of medications after a heart attack are the statins. These include statin in their generic name. So we've got atorvastatin, rosuvastatin, simvastatin, pravastatin. They may also be known as by their brand name. So for example, atorvastatin may be known as Lipitor, and rosuvastatin may be known as Crestor. Now, statins work by lowering your bad cholesterol, or LDL cholesterol. And statins may raise your good cholesterol, but usually only by a small amount or not at all. So I'd encourage you to listen to the cholesterol talk to learn more about cholesterol. Now with statins, studies have shown that they improve the quality and length of life in patients who have had a heart attack or known coronary artery disease. The most common side effect for statins is muscle pain or cramps or even muscle weakness, and you should report this to your healthcare provider. In addition, statins may affect the liver, and we monitor liver function tests periodically. Severe liver impairment is a rare side effect of statins, so you need to contact your healthcare provider if you notice any yellowing of the skin or eyes, which may be indicative of a liver disease. So on an ongoing basis, we monitor muscle pain, cholesterol levels, and liver function tests may be ordered periodically as well. So next, we will shift to a medication that provides more symptomatic relief and may be used either regularly or on an as-needed basis. So nitroglycerin provides symptomatic relief of chest pain, and it comes in long-acting forms, such as the patch or sustained release tablets, and it comes as a short or quick-acting form in the form of a spray or sublingual tablets. Nitroglycerin is used for the treatment and prevention of chest pain or angina pain. The quick-acting spray or sublingual tablets are used for treatment, and the long-acting patch or sustained release tablets are used for prevention. Nitroglycerin dilates the blood vessels of the heart and thus increases the blood flow and oxygen supply to the heart. This relieves the pain associated with the heart muscle not receiving enough oxygen. It is important to know how to use the nitroglycerin spray properly. When experiencing chest pain, you should sit down, as the nitroglycerin can affect the blood pressure and lead to you feeling lightheaded or dizzy, and could potentially make you fall. So it's always best to sit down. And what you need to do, if you haven't used your nitro spray in a really long time, you need to make sure that you prime the spray and actually do a couple pumps into the air to make sure there's actually liquid coming out. But then once you know the liquid is coming out, you can spray or place the tablet under the tongue. And if the chest pain is not relieved, you need to repeat the dose every 5 minutes for a maximum of 2 doses. And if the chest pain is still not going away, you need to call 911. So longer acting products are used to prevent the chest pain, so it's important to use regularly. However, your body gets used to the medication if you use it continuously. So you need a period of time over a 24-hour period or a whole day to be without the medication. This is why the patch is worn for 8 to 12 hours in the day. For instance, you may put it on in the morning and take it off at nighttime. Next, I will talk a little bit about anticoagulants. To note, these are not used routinely in people who have had a heart attack, but are common medications we see in patients who have common irregular heartbeat condition of atrial fibrillation or in patients who have had valve replacement. Warfarin or Coumadin is the oldest medication in this class, and there are newer anticoagulants, those being dabigatran or Pradaxa, rivaroxaban, Xarelto, and apixaban or Eliquis. Warfarin works by blocking the effects of vitamin K in the liver. Now, vitamin K is necessary for helping blood to clot and prevent bleeding. So warfarin will block these effects and prevent clots from forming, which is a desirable effect in a person who is more susceptible or more at risk of having clots form. Warfarin is used for preventing clots and specifically preventing stroke in patients with an irregular heartbeat or more commonly atrial fibrillation. It is used in people with clots in their veins, such as leg veins or blood clots in the lungs. It may be used short-term if a person has had a large heart attack and there's some indication where there may be a clot within the heart chambers. Also, it may be used in people who have artificial heart valves. The main side effect of warfarin is bleeding or bruising. Rarely we see people have skin rash or discoloration with warfarin. For monitoring, we monitor something called INR, or International Normalized Ratio, what looks at the time it takes for bleeding to stop. With warfarin, the INR monitoring by blood testing is routine. So initially, INR monitoring may be frequent when we are figuring how much warfarin your body needs to work effectively, but this should become less frequent and could be perhaps down to once a month for people who are on long-term and have a stable INR. Now, you need to seek medical attention for serious signs of bleeding, such as the dark stools, blood in the urine, bleeding that does not go away on its own. The newer medications are alternatives to warfarin. So this is the dabigatran, rivaroxaban, and apixaban. Now, in simple terms, they work similar to warfarin and have bleeding risk like warfarin. Advantages over the warfarin include no INR monitoring or routine blood work. But the disadvantages that they're newer and much more expensive, and most have no effective antidote, although there is one on the market now for one of these agents. So when needing anticoagulation medication, you need to discuss the pros and cons of these options with your healthcare provider or specialist. Now, tips to remember: tell your doctor and dentist what medications you're taking. And this should include herbal supplements or over-the-counter medications to ensure there's no interactions with medications or harm in specific medical problems that you may have. Also, you do not want to stop your medications abruptly on your own. And you need to consult your pharmacist and doctor before starting any new medications. And again, this will be in the case of herbal medications or over-the-counter medications. Now, as you know, medications are not the only answer. We still need to remember lifestyle modifications, diet, exercise, smoking cessation, and reducing stress. That concludes my presentation on cardiac medications. Thank you for taking the time to view this session and for participating in the Fraser Health online cardiac rehab education program. We hope that you view all sessions as your schedule allows and find them helpful in recovering after your cardiac event. Thank you.